past MA President for Karnataka State Bank, and also I'm the Karnataka Medical Council member. Uh, Today, we are having discussion regarding the OPD practice in COVID-19. As you all know, we are facing a lot of problems with our medical profession. All these days, we had problem to start a clinic, to get a license and other things. And we had some problem with the public also. Now, a virus has come, the coronavirus. So now it is very difficult to practice without proper precaution. In fact, we have to have a proper protective measures to start a clinic, especially situations like this. If you have a small clinic in a crowded area without much space and without much hygienic conditions, definitely it will be harmful not only for the doctors and even for the public, because the number of patients, they will come and sit there, so we don't know who is positive, and he may spread to not only to the doctor and even to the other patients. So for that reason, especially the doctors more than 60 years or more than 55 years, it is better not to open their clinic. That is my personal view. But according to the epidemic law and the disaster law, as a doctor, you should not close down your clinic. But when you look back to the other diseases, compared to the previous epidemic, this one is really a little very harmful and very contagious. So, single doctors, it is very difficult for them to practice.
So I'll just do that.
Along with me, I'm having Dr. Puttraju, who is a physician. So I'll ask Dr. Puttraju, please introduce yourself.
Yeah, I'm a consultant physician. Previously, I was working as a teaching faculty at Sri Siddhartha Medical College, Tumkur. Now I am a full-time private practitioner, mainly looking after diabetes OPDs and internal medicine. Thank you.
Okay. Shall we go ahead with the presentation?
Yeah.
Okay. So for the single doctor's clinic, next slide please. Single doctor's clinic, actually the general practitioners, especially the general practitioners, where they will not have adequate space, adequate facilities, and it is a closed room. So most of the time, there is no waiting area, there is no receptionist and other things to segregate the patient, and there will not be any person who can ask the patient to sit or to maintain the social distance. So these problems are there. So suddenly, if they start, they cannot maintain all those things. Second thing is, as a single doctor, they don't have adequate precautions like the mask, which is not available, and PPEs, which are also not available in the most of the places, especially in the rural areas. So they're really facing a lot of problems, and most of these general practitioners are more than 50 years. That is also one of the important things, because youngsters are not doing general practice, they are going to become specialists. So when you look at the general practitioners, most of them are more than 50 years. So they are at risk, because invariably they will have comorbid conditions, and so this will be little dangerous. Second thing is, even if you get masks and PPEs, so the mask itself, that is especially the N95 mask, which the general practitioners wear, it will cost him more than 300 to 350 rupees. So is when you look at the consultation fees will be very minimal. And if you can see, especially in the lockdown period like this, if you can see one or two patients, so it will not cost for even the mask also. Then there is no question of PPEs. So if he wants to wear PPEs again, it will be a cost for him. Who is going to bear for this? So that is also a question. So really, the cost of equipment will definitely stop him to practice. And another thing is, the patient may be having some problems, and they will not be having investigation facilities in their clinic. They have to refer them for the laboratories, and the patient will be moving from one place to other place. So that is also a big problem from the single doctor clinic, from a general practitioner. And again, as I said already, segregation of non-COVID patients, it is unless you have thermal scanner, other things, so you cannot do all these things. So this is really a problem for a single doctor clinic. It is very difficult for them. But if you have an adequate space, and if you have some open space in front of the clinic, and you are younger, and you can still practice if it is open space or adequate space is there. So definitely, with all precautions, so we can advise the doctors to practice. Then next slide, please. When you come to the specialist doctors clinic, specialist doctors will have a better space and better equipment and investigation facilities also. Usually they will have a reception area, they will have waiting area, they will have side labs. So they're having manpower also, so to segregate the patients, all these things. But still, it will be a closed space again, and they will be having AC. So with AC and closed space, actually you are not supposed to practice. So it is better, even for my advice for the specialist doctor clinic, they should run their OPD in a nearby nursing home, or where they are attached to one particular nursing home or any hospital. So that is better practice. But as you see, most of the non-government organizations and the politicians, they always blame the doctors are not open the clinic. But the problems are there, so we have to understand why we are not opening. It is not that doctors getting the disease. In fact, you are spreading the disease from one patient to other patient. So for that reason, I am stressing that OPD clinics usually it should be closed. Anyway, but specialist doctors, since they have better space and other things, so still they can open their clinic. And also they will have supporting staff, and lab facilities will be there. At least routine checkups like blood pressure, you can see ECG, and other any blended investigations, you can definitely see in a specialist clinic. Ideally, we should have a fever clinic. So fever clinic, actually, you should have in all the urban centers, the cities, and in the rural area, all the PHCs, they should have the fever clinic. And in medical colleges, they should have the fever clinic. And in fact, in IMA, we are planning to have one fever clinic where this fever clinic should be in an open space, usually simple a tent or some shamiana tent. You can put a fever clinic there with all precautions, especially the protective things like goggles and the mask, N95 mask with personal professional, personal protecting equipment. Next slide. So how long you want to do all this? See, the virus has come and it stays and it will be staying with us. So that we have to keep in our mind. We are preventing spreading from one person to other person because we are overcrowded. We are not maintaining the social justice as a social distance, and also usually we are not following the hygiene and other things. So we are not keeping all the things which are clean. So these things definitely can do better, especially if there is lockdown. So you can see in some of the markets, so there will be so much of overcrowding, and they will be touching so many things, and so that is how how it spreads and all. But when it will be lifted, already this is our Prime Minister has announced that up to May 3rd. May 3rd, this phase may continue, but we don't know when they will lift. Whether if they want to lift, how suddenly they lift all the lockdown things or not, we don't know. So what will happen if there is lockdown is lifted? So that is also a big question here. So I think we have to. There should be a big debate on this, because we are right now not knowing how and when, and we don't know what will happen also. So this lockdown period, if you lift it suddenly, we may face a lot of problems, one thing. And you should be prepared for this. So you should have a reserved number of doctors. Okay, so that is the reason I am stressing. You should not utilize all the doctors for these OPD clinics and other things. So you can have a data of all the doctors, specialists and other things. You can keep them reserved, especially if there is sudden increase in the cases. So definitely you need more doctors, more trained doctors. So I think you have to be ready for that. Next slide, please. Then post-COVID, definitely it will be a problem for the doctors to practice. So we have to change our lifestyle. We don't know, whenever we see the OPD or even the OT, we don't know whether we are contaminated with these type of viruses. So naturally, we have to take bath once you come to the house without touching anything. And using masks and gloves in OPD becomes a new normal. So you have to suspect every person. So like in HIV, whenever we want to treat, we always think that the patient will be having HIV, so that we are taking universal precautions and we treat. So like that in the future, we have to think that probably, as I said already, the virus is there and it will be there with us. So you have to have a suspicion and you have to use proper precautions, so wearing gloves and masks, even the glasses also. So for these reasons, we may have to cut down our timings, so OPD timings maybe, little come down, then we always, it is better to practice only an appointment, restrict the patient, especially who are walk-in patients, you can restrict and see the patient only on appointment. Then social distancing will become a new norm. Next slide. Use of disposables. So this is in country like us, a developing country. We may not be affordable for most of the disposables, but now it is inevitable. We have to use disposables with increase, which may increase drastically the cost of the procedure, naturally burden onto the patient. So it is definitely the cost will rise and patient has to bear because of all these precautions. Air sterilizers or any new type of sterilizers will become a routine hospital feature, and footfall of normal patients will decrease. Simply they cannot just enter into the hospital because they will also think, if I go to the hospital, I may contaminate it or I may contact some disease. And not only that, the prices will also rise, consultation fees, everything will rise. So they will be afraid to visit just like that. And only in case of emergency, the walk-in patients may. Next slide. People will prefer to avoid social gatherings. This is actually, it's a good thing. One way it's a good thing, especially like marriages and festivals and other in villages. So usually there will be lower number of people they gather. Okay, so usually there will be exposure of these type of diseases, especially, so they contaminate. So definitely they will be afraid to gather in a big group, and they will avoid journey by public transport, and even to visit some restaurants. So you can see, especially in Bangalore, all the restaurants are full. There is no space. You have to wait for everything. So I think these scenarios will change. And traveling abroad, especially the people, usually when you go to the airport, it is worse than the majestic bus stand. So much of people will be there near the airport. Probably that may come down because of this disease, as well as the cost will also rise. So traveling abroad, especially for the doctors, so usually they will avoid traveling. And usually the conferences and CMEs, usually we used to go for the conference and CME from one place to other places. And now the doctors will definitely avoid all these things. And doctors will also avoid meeting unnecessary things, especially like medical representatives. So after a few days, the companies will start doing online promotion on. Next slide. Even the IMA and all the doctors were suggesting government to have health insurance. Umpty number of times we have requested, but the coronavirus now, I think probably it will educate the people to have health insurance, and it will become a mandatory. So there will be flow of cashless patients, and these patients will increase. Definitely, government is already having some stringent law to open a clinic. Now they will have further more stringent things, especially when they want to give permission to new hospitals. and ICUs. So all the hospitals should have an ICU or isolation room. So these may become mandatory in the future. Overall, hygiene standard of general public will increase. So other communicable diseases will also go down. So one way it is definitely a better thing, and coronavirus actually start a lot of things to adopt, especially the spacing and hygiene and other things. Next slide. Public health departments will become more prepared. So because most of the people, they prefer this public health, so they should have adequate number of beds, number of equipment, number of manpower, and other things. So they have to be well equipped and they have to prepare. Medical examination at airports will become compulsory. So I think this will be mandatory, definitely. So because we are seeing lot of new viruses. Okay, so this will definitely come. And vaccination against COVID and other contagious diseases will become mandatory. So these things will become mandatory in the future. So we have to go accordingly. I think we have to adjust with whatever the post-viral effect. Thank you. Thank you for this is a brief about the COVID. At the time of COVID, whether we have to practice or not, and if you are practicing, what are the problems we are facing, and post-COVID also, how we may have to change for the COVID status, post-COVID status. I think Dr. Puttraju will summarize the thing, or you can add some more points on this. Thank you.
Thank you, sir. I think the scope of this topic is OPD practices. What are the do's and don'ts? Most of the things Dr. G. N. Prabhakar sir has already alluded to. So I will just add on some of the points, like first thing is whether the scope for OPD practice, is it necessary during COVID and post-COVID? What is the situation? So presently we are under lockdown. That is because to avoid overcrowding in the healthcare facilities, so that they do not become a nidus or epicenter for transmission of this virus. So that is the reason why we for some time we have closed our OPDs, but we cannot close it forever. We cannot close it for a long time, because the patients, like as it was already addressed, those patients who have non-communicable diseases like diabetes, hypertension, thyroid problems, those patients with cardiac diseases, so they need to come for periodic follow-up, and they will be really anxious sitting at home, what will happen to them. So the healthcare providers need to be available for these kind of patients, and also for emergency services in major healthcare facilities. But at the same time, the first law is to protect yourself to protect others. So how doctors should work during this period of COVID, especially with specific reference to single doctor clinics. I'm just going to add on some points to what Dr. GNP has told, the do's and don'ts. First thing is, as he has already told, one is the age of the doctor. So if a doctor is elderly, say 60, 65 years, he has some chronic medical conditions like diabetes, hypertension. If somebody has undergone, is having ischemic disease, they will be more, they have to be more, take more precautions. Other thing is the space and facility, as already told. So first thing is, if somebody want to do OPD practice, what are the do's? So prefer telephonic appointments or online appointments. Preferably, as he has already told, avoid walk-in patients. The second thing is restrict the OPD hours to limited hours. So generally, the tendency in private practice is to do 2 sessions. We do a morning session. Some people do for 4 hours, 6 hours. in one stretch. Some people do for 8 hours in one stretch. Then they have a evening session 2 to 4 hours. So instead of this morning evening session prolonged stretch hours, restrict the OPD hours to say 3 to 4 hours, maybe morning session. Okay, so it should not be an extended period of time. Then other thing is restrict the number of attenders visiting the healthcare facility. The number of attenders should be minimal. So always you should have maintain social distancing of 6 feet, if not 6 feet, at least 4 feet, especially in the waiting room and when you are interviewing the patient. So when you are history taking, you should interview the patient at a distance of at least 4 feet, preferably 6 feet. And you should encourage the practice of hand hygiene. Even before the patient walks into the healthcare facility, we can, advise our reception or the administrative staff in the entrance of the healthcare facility to, sanitize the hands of the patient. So encourage hand hygiene even for the patients. And we should educate the patients and the patients' attenders. So we should put awareness posters in front of the clinics about hand hygiene, the WHO recommendation of how to do hand hygiene, how to wash their hands with soap and water or a alcohol-based hand rub, and teach them about the respiratory etiquette. When they cough or sneeze, how to contain their secretion. Either they have to use a face mask or they have to cover their face or cover their cough and sneezing using their elbow. Then all the OPD providers have to have a protocol for disinfection. Like as I told, for the patient's hand hygiene and respiratory etiquette. So disinfection of the patient's seating and the coach, when we put the patient for examination, we need to adhere to that protocol of disinfection. And we should always have a red trash bin for biomedical waste management. Whatever contaminated waste, the recyclables like the gloves, tubings, IV tubes, the urine bags have to be disposed through a red trash bag. And training, every practitioner, whether it is a general practitioner or a specialist doctor doing a clinic, they have to have adequate training on the judicious and rational use of the personal protective equipment. So for a OPD practice, what are the personal protective equipments that are required? How to use them, how to put on them, and how to remove them? What is the scientific method? One has to become aware of it and take proper training before they start doing it. So every OPD should have a triage area, as Dr. GN Prabhakar has already told. Initially, they have to be screened. One should have a space for triage, and we have to prioritize our patient or fast track our patient. Those who have respiratory symptoms, patient coming with fever and acute respiratory tract infection have to be fast tracked. They have to be prioritized and seen first, and they have to be sent. Those patients without respiratory symptoms can wait for longer. So it is fine. And the PPE for patient examining the patients with respiratory systems and PPE for examining the patients without respiratory systems are different. So one has to become aware of it. Like for those healthcare worker providing examining a patient with respiratory system, the recommended PPE is the level 1 PPE, that is standard precautions. Standard precaution is the hand hygiene, respiratory etiquette. Along with that, contact precautions like wearing of the gloves and a gown, and eye protection, and of course droplet precautions using a mask. Now the question is which mask to use in OPD practice. So far we know that this virus is transmissible through droplet spread. Whether it is spreads through it is a airborne transmission is there or not, we still do not have a proper paper on that, but there are some records which say there is a aerosol transmission, especially the short range aerosol transmission, which can stay in the air aerosol for about 3 hours. So when you are examining a respiratory patient, you need to have a mask, preferably N95 mask. But the WHO recommends, because maybe I do not know whether because of the short supply of N95 respirators, they have recommended a surgical mask or not. WHO and CDC recommends a triple layer surgical mask or a medical mask, along with gloves, gown, and eye protection. But for patient without respiratory system, standard precautions and other things, you can assess the risk, whether it is a high risk patient or a moderate risk, low risk. Accordingly, we can provide the PPE. So all patients, we have to ensure that all patients with respiratory system who come to the healthcare facility, they must be wearing a triple layer surgical mask. That is very, very important. So if a patient without respiratory system, no PPE may be required. So waiting area, you have to space the chairs to have a spatial distance of at least 1 meter. So patient with respiratory system, ensure they are wearing medical mask while they are seated in the waiting area also. The administrative staff also should maintain a 1 meter distance with the patient. They may wear mask, triple layer surgical mask, or if they can maintain a spatial distance of 1 meter, if there is a short supply of PPE, so PPE may be required for the administrative staff. Another thing is very, very important. If you are doing a OPD practice, it is very, very important. So it is a law that you should notify all cases which present with influenza like illness or severe acute respiratory illness to the respective surveillance center in your area of practice, either a district district health and family welfare office, or there will be a district surveillance officer. We should have that number, and we should provide the name, age, address, and the mobile number of the patient who presented to you with these symptoms. Now, just to make the practitioner familiar as to what cases they have to notify, what is ILI, that is influenza-like illness. Any patient coming with acute respiratory tract infection, like for example, you measure the temperature more than 38 degrees centigrade along with cough and the onset of illness less than 10 days. That is an influenza-like illness. These cases have to be reported. What is SARI? That is severe acute respiratory tract infection. The WHO definition says any acute respiratory tract infection who presents with fever, that is the measured temperature of more than 38 degrees centigrade, has history of cough, difficulty in breathing in the last within 10 days, and patient requiring hospitalization. So this patient defines as a SARI. These cases, ILI and SARI, have to be notified to the respective district surveillance officers or the district health and family welfare office. What are the don'ts? Don'ts, as I already told, avoid walk-in patients. Avoid aerosolization procedures, especially in the OPD clinics. You should avoid nebulization because nebulization can generate aerosols. So you should avoid giving nebulization to patients, and avoid or at least try to minimize doing any invasive procedures. So you should actually practice safe injection practices. As far as possible, try to avoid any parenteral injections, intravenous injections, drip services, unless and otherwise it is very, very genuine and indicated. So I think these are some of the don'ts. I thought they are pertinent. What after lockdown? COVID-19 has impacted our life very significantly. Life is never be the same again, as Dr. Prabhakar has told. There is fear both among the public and also among the healthcare workers. So we should learn to work with logistics and common sense. So we should learn to triage our patients, take standard precautions, learn about the putting off PPE, what PPE is required for what level of care, how to use the PPE judiciously and appropriately, what are the disinfection protocols that we have to follow. These things should, so post-COVID, these things should stay with us permanently. Not that the COVID is there now, after a few months, we are not going to practice this. I think this practice should remain with us permanently in our practice. That is triaging, taking standard precautions, appropriate use of PPE according to the risk, and the disinfection protocol. So the most important, I will summarize, single most important measure to prevent cross-infection in any healthcare facility is the hand hygiene. According to the survey that is been observed, that the rate of adherence to hand hygiene, that is the compliance to hand hygiene among healthcare workers, is abysmally low. It is less than 50%. So we, being the healthcare providers, we need to adhere to the hand hygiene properly. Then following respiratory etiquette, second most important thing, when during your practice, avoid touching your eyes, nose, and mouth with the hands. So every time you see the patient, after seeing the patient, do the hand hygiene. Sanitize the medical equipments, that is the stethoscope, the pulse oximetry, or the BP apparatus that you use. Sanitize with appropriate disinfectant solutions, and use appropriate PPE according to the risk assessment. Like, for example, I told patient with respiratory symptom, patient without respiratory symptom, what PPE to use. And of course, follow the disinfection protocol, the clinic area, what solution to use, and the surfaces to be cleaned, and the medical equipments have to be sanitized. So these things one has to be aware of. So if one does not have all these facilities, such options where you do not have enough space to practice triage and maintain a social distance, you do not have such options. Ideally, such standalone clinics should stay closed to prevent further transmission of infection. What are the alternative options? As Dr. Prabhakar has already told, we can set up small mobile clinics like using tents, something like that, possibly in the open public areas that are naturally ventilated, where we can triage, we can manage the crowd, we can have facilities to triage and control the crowd, and the area can be easily cleaned, and there will be options to refer the patients to higher centers. And wherever possible, use teleconsultation facilities as outlined by the Government of India and the Medical Council of India. So you make patients only visit the healthcare facility wherever there is a definite necessity. Otherwise, we can practice teleconsultation as per the guidelines of Medical Council of India. Thank you very much.
Thank you, Dr. Prabhakar and Dr. Puttaraj. So you have very nicely put down those points specific to single clinics, to specialty clinics, age groups, and specific to each requirement. So you've been very, very clear. But there are certain questions that have actually come from the audience. So the first question is, you have already mentioned about teleconsultation, but the question is that what is your opinion regarding teleconsultation on payable basis and its legal aspects, specifically with respect to prescription and others? Dr. Prabhakar?
Can you repeat the question?
So what is your expert opinion regarding teleconsultation and on payable basis and its legal aspect, especially in terms of prescription and everything?
Actually, the 25th of March, the Medical Council of India has released guidelines to follow teleconsultation. So one can do teleconsultation using a smartphone. Either they can do they can answer over the telephone call, or they can do chat consultation using WhatsApp or Facebook or video conferencing. All this is legalized. There are certain norms. When you are giving a prescription, there is a certain protocol has to follow. Like a doctor has to identify with his registration number of the medical council, the specialty that he is practicing. All that has to be there in the letterhead, and the patient details, and the brief history and diagnosis, and the prescription has to be written, and the same thing can be photo scanned with his signature and can be put it on the WhatsApp, or patient can receive through either e-prescription, email or WhatsApp or messages. This is legalized. This is the latest development, that is after 25th March, the Medical Council of India legalizes teleconsultation. And one can avail their consultation fees through various means, like they can put there are some apps they can use where the patient, they can charge, or they can do it free, depending on the individual choices. It is legalized. Teleconsultation is legalized now.
Thank you, Doctor. Dr.
But
Prabhakar,
actually,
you have something to add?
Yeah. Teleconsultation, actually, it was, only for the COVID, they have given this permission, but we don't know in the future, they may lift this.
Okay. So in terms of your opinion, what about the other patients if they want to consult their doctor?
Can I add on to it? Teleconsultation is allowed for example, my diabetic patient he wants to come for a follow-up, but he does not have any problem. He just want to know that he wants to continue the same medications or not. He wants just a refill of medications. So in that case, he need not visit the healthcare facility. If he's doing well with his previous medications, he can be advised to continue the same medication. We just have to refill the prescription and send it across. So for all these patients, we can do. Only those patients, so we need to take a proper history by doing a telephonic interview, whether the patient can be advised teleconsultation or whether the patient requires a in-person consultation. At any moment you feel that the patient requires a physical examination, or patient has some emergency that he has to visit a healthcare facility, then teleconsultation cannot be done. It is only for those patients who have some trivial ailments, or they have some anxiety related to COVID. So we can do psychosocial counseling, or they can be reassured over telephone, or they just want have some generalized aches and pains, some fever. It may not be COVID, so advising paracetamol or just home remedies or just refill of the previous prescriptions, that can be done over teleconsultation even for other diseases, especially for diabetics. Like patient is taking, he has a glucometer of his own, he is monitoring his blood sugars, and he can share his blood sugar readings with a treating doctor. And if he is taking insulin, I can always adjust the dose of insulin over telephone or e-consultation.
Thank you, Doctor.
Yeah.
Dr. Prabhakar, the challenge actually comes in our country where, in remote areas, all these points that you have mentioned with respect to OPD practice may not be able to take up exactly as is. So the question is that how do you tell doctors to practice in remote areas during OPD timings?
Remote areas, actually, as you said, it's definitely it's difficult, but we have to educate our doctors through IMA, and we are already started educating the our doctors how to practice. As already Dr. Puttaraju said, what are the precautions you have to take. The same thing will apply even for the rural areas also, the remote areas also. But one good thing in the rural area, remote areas, it will not be overcrowded, and spacing, they will have adequate space. They can utilize those space, and they can definitely do better than the crowded areas like in cities.
Okay, thank you, Doctor. Dr. Puttaraj, anything to add?
Yeah. What they can do in remote areas, actually, small places, it may be much easier to do. They can, instead of their clinics, they can choose a government school or a community center where it is more ventilated. They can, as we told, that they can set up a mobile clinic. So there, and where crowd control can also be done, they can be made to wait in the open ventilated areas. I think such alternative arrangements can be done. And those cases which require definitely higher consultation referral, they can be appropriately referred to the higher centers.
Thank you, Doctor. There is one more question in terms of disinfection of medical instruments like pulse oximetry or let's say a nebulizer, which will be used on repeated basis. So what would you advise practitioners on that?
The first thing is I would advise is not to use nebulization. As I already told in the don'ts, avoid nebulization during the COVID time right now, because that is a aerosol generating, it comes under aerosol generating procedure. Although it may not, the aerosols may not come from the aerosols may contain only the nebulization solution, but still one has to be very, very precautious. It is preferable to avoid nebulization. Regarding the sterilization of disinfection of the stethoscope or the pulse oximetry, you can use say Lysol solution, the Bacillol solution, which contains 70%. Anything which contains more than 65 to 70% alcohol solution, you can use a cotton swab or a wet cloth and disinfect your medical instruments.
Dr. Prabhakar, your opinion, sir?
Yeah. So actually, the surfaces and other things already Dr. Puttaraj has told with the disinfectant like hypochlorite solution, other things. But these equipment usually alcohol-based solutions in clinics.
Sir, what about patients who are having respiratory problems? Definitely you cannot immediately distinguish when they are sitting in the waiting area. So when you yourself as a healthcare professional are handling them, what sort of specific care you should take for a patient suspecting of COVID, or say someone walks into your clinic? What would you do, sir?
Respiratory cases, I think Dr. Puttaraju will answer better because he's a physician.
If a patient comes with a respiratory symptom, first thing is we should make sure that they come with a surgical mask. Or if they present to the clinic without a respiratory, the surgical mask, we should be in a position to provide a surgical mask, because they cannot be, otherwise if they are sitting in the waiting area, they can be a risk to the other patients who are in the waiting area. So first thing is you have to ensure that any patient who comes with a respiratory system should be wearing a triple layer surgical mask. Second thing is hand hygiene. Before they enter the healthcare facility, their hand should be washed with soap and water, or you should provide a hand sanitizer for them. And they should be sitting at least 3 meters, I mean the 3 feet or 4 feet distance with the other patients. These are the essential things. Then when they present to assess the risk, whether that patient is a simple flu-like illness or is an influenza-like illness, or whether it is a COVID, yes, you need to have a questionnaire. Like in our center, our district health and family welfare has developed a questionnaire. Even we from our Indian Medical Association also, we have prepared a questionnaire, a kind of a SOP to assess whether this patient is a possible COVID, this patient is a possible flu. We have a questionnaire where we give points. Like for example, I will read out what are the questionnaires. Like for example, you can ask the patient whether you have cough, cold, sore throat, fever, headache, myalgia, headache, diarrhea. So all these symptoms, for each symptom, we are going to give 1 point. Suppose if the patient has got fatigue or shortness of breath, then he is given 2 points. If the patient has traveled in the last 14 days to a COVID infected area, now the international travel is out of question. So we are not talking about imported cases now. We are talking about local transmission. Suppose if anybody has traveled to a COVID area where it is a cluster zone or it is a COVID hotspot area, that becomes very significant, and that point carries 3 points. Or the patient has come in contact with a COVID patient, lab confirmed COVID patient, he carries 3 points. Or the provider, he is providing care to a patient comes with respiratory system and he is providing care to a COVID positive patient at home, then that also carries 3 points. So based on the number of points, we are going to assess the risk. So some patient has got only 2 score, then that patient is possibly, you have to say is stressed up. You can reassure him and send him home and ask him to monitor his symptoms. If there is any worsening of symptoms, he can always be asked to come back and advise him what to do, where he has to go. If the patient has got 3 to 5 points, then again, we have to emphasize personal hygiene, respiratory etiquette, and adequate oral hydration, and be at home, quarantine at home 14 days. So, and monitor for any worsening. Suppose patient has got 6 to 12 points, then he need to undergo consultation with the doctor. The doctor will assess the severity, whether he requires any investigations, whether he requires any isolation or any testing for COVID. So any patient who carries a score of more than 12, this patient has to be notified to the district health and family welfare office or the district surveillance office. So all the particulars of the patient, age and sex, mobile number and address have to be recorded, and that has to be provided to the district surveillance officer or the district health and family welfare. So everybody, we need to have a printed questionnaire in our clinics. So any patient with respiratory system symptoms come, we have to go through this questionnaire and make a score, and according to the score, we have to stratify the plan of action.
That's why we have to screen before they enter into the clinic. That is one thing. And it is not only for the respiratory symptoms, even for others also, we have to ask them to wear masks before entering into the clinic. That is, for all the patients, they should come with the mask.
Right. Thank you, doctor. Thank you very much. Thank you, Dr. Prabhakar. Dr. Puttaraj, you have excellently put down all the points in terms of clinic managements and all. And I'm sure the audience is very happy and informed to gain this knowledge as to how to proceed and what to proceed. So thank you very much, doctor. Thank you very much.
Thank you.
Thank you.